During the COVID public health emergency, there was an explosion of telehealth opportunities for virtual care for many patients. It was a fast change for pediatric providers. Many pediatricians are facile with virtual care delivery, but the ability to convert your entire practice to the virtual space in a short time due to a weather emergency or other disaster must be planned and practiced in advance. I'm sure you're concerned about being reimbursed for virtual care that you provide, as are we all, but there are constant updates from CMS on how to maximize and optimize your reimbursement. Keep up with technical assistance resources such as this from the Center for Medicaid and Medicare Services so that you can be reimbursed for all the virtual care you provide. And you may live in a border state or a border area where you practice across state lines, and you may wonder what's allowable for my telehealth practice within or across states. And the Federation of State Medical Boards can be an invaluable resource. So you can see this is updated frequently to tell you what the waivers are for practicing across state lines and other really important regulatory information. In fact, there is a very serious effort afoot to allow for what we call the Interstate Licensure Compact, to allow providers to practice across many state lines. Wouldn't this be fantastic in a catastrophe when one state or one part of the country had been knocked out by a weather emergency, a catastrophic event that really created another part of the state needing to step in through virtual care and practice in the other region. This effort is underway, and you might want to check and see if your state has joined the Interstate Licensure Compact. We all worry about medical malpractice liability. During the COVID emergency, and in fact, it's an emergency that's still ongoing, there were many liability waivers. Check with the Center for Connected Health Policy to really understand what is still within liability waivered telehealth auspices in your state. You may very well be practicing in a state that has stood down all waivers, and in fact, you have to practice to some former standards. But this can really help you. And if you're worried about liability, the best advice I can give you is always understand what your personal liability insurance coverage is for virtual care along with your regular practice. When disaster strikes, it might be that the liability will be waived, but it's important to understand before disaster strikes what your parameters are. And last but not least, the American Academy of Pediatrics is working to include all children to have access to quality pediatric health care. Many children do not have access because they live in rural environments, or they don't have access to Wi-Fi or a good cell service. But the American Academy of Pediatrics is working on this because if there's a catastrophe or a weather emergency and you have to convert your entire practice to virtual within a few hours, we really want you to understand how to do that before a disaster strikes.